Okay. Well, my name's Helen Stokes, and I'd like to welcome you to this seminar presented by the Melbourne Social Equity Institute as part of our Mental Health and Society seminar series. First of all, an acknowledgement of country. I acknowledge the Wurundjeri people of the Kulin Nations and their elders, past, present and emerging. Just a little bit of housekeeping first. This session's been recorded and it'll be made available on the Institute's website after the event. If for any reason there's anything that you find challenging in the material, please feel free to just leave the webinar and then look at it in your own time on the Institute website, because it'll all be recorded there. We're using the Q&A function. So please post any questions that we have, and we'd love you to post questions for the speakers in the Q&A box, not in the chat box. The chat function is turned on, but it's just for people to say hello to each other and chat amongst themselves. Okay, I'd now like to introduce Melissa and Magenta. So Dr. Magenta Simmons is a Senior Research Fellow and the Youth Partnerships in Research Coordinator at Origin and the Centre for Youth Mental Health at the University of Melbourne. Her work focuses on how young people can be meaningfully involved as collaborators in research projects, in clinical decision-making and about their own mental health care, and as peer workers supporting other young people through peer support. And in this presentation, we've also got, which we're very pleased about, Melissa Keller-Tuberg, who's a youth mental health advocate and aspiring researcher studying a Bachelor of Psychology honours at Swinburne University. After recovering from her own mental health issues and experiencing the limitations in current services, Melissa became involved in youth mental health constancy across a range of organisations and settings on Origin's Youth Research Council and Research Review Committee. So now I'd like to hand over to Melissa and Magenta to do this presentation. Thank you very much, both of you.
Thank you so much, Helen. And I just stopped sharing my screen to make sure that it wasn't my email that was dinging. And now that I have gone to share it again, it's not coming up with the right screen. So sorry, excuse me while I try and sort that out. I will go back into presenter mode. Sorry. And stop sharing. And then I will share the one that doesn't give you our notes. Okay, apologies for that delay. Thank you so much, Helen, for introducing us, and thank you to the MSEI for inviting us to give this talk. Thanks, of course, to Mel for joining me today. It's really a joy to have you here. This is a picture near where I live, near the Mary, and we'd also like to acknowledge the traditional owners of the lands on which we're all meeting today. For us too, that is the Wurundjeri people. We'd like to pay our respects to their elders, past, present, emerging, and to acknowledge that sovereignty was never ceded. This is where we are today. We're at Origin, and so we are talking about involving young people in mental health research. We're associated with a youth mental health organisation, so we're talking about young people, just to give you a frame, aged 12 to 25. And Helen's done a great job of introducing me, but Mel, is there anything else you want to say about yourself?
Yeah, so just a quick little introduction. My name's Mel, I'm 23 years old, and as Helen has mentioned, my perspective is someone with a lived experience of mental illness, and through my recovery and advocacy, I've become really passionate about the idea that people from the lived experience community really should be given a voice in decision making as much as possible. And that's as true in the context of clinical decision making as it is for research. Because whilst we all have these stories and the things that have happened to us through recovery and illness, they're not just you know, it started here and it ended here. It's a perspective that can really valuably be applied to a whole range of contexts. And I really do think that the mental health system could harness that power for positive change.
Yeah, for sure. And so we are talking about the different lenses that we all view things through. So, you know, I view things through the lens of a researcher, and Mel's coming here as an emerging researcher and with that lived experience lens as well. And really there has been a growing shift towards the involvement of people who have lived experience of mental health challenges or mental health service use. And we've seen that recently in the Royal Commission into Victorian Mental Health Services, a clear focus and an increasing focus on how that lens is valuable to mental health research as well, which is really exciting because there is a clear rationale for doing this. We know that, you know, involving people with lived experience in research does improve the accountability, the transparency, relevancy. It gives us really unique insights into, you know, the issues that face people with mental health challenges that we wouldn't otherwise have. And that's really important so that we can improve outcomes with the research that we do. But involvement in research has been kind of slower to make significant gains, especially in the youth settings. Internationally, there is a lot of interest and good work going on too. Often it's about programs running rather than research about how to do it best, but that is growing as well. So we're really excited to see some of that stuff. And we do think it's important that this is done.
Yeah, I absolutely agree with that. If I was going to describe why a researcher should engage in youth consultation, I would put it very simply. It just increases the quality of the research, and that can apply at a bunch of different stages and different ways. So for example, if you were engaging with young people early on in your research project, you might be able to get a better idea of the research questions that matter to the community and therefore can make a positive difference in the community. Or then when it comes to minute details, for example, reading participant information and consent forms and making sure that the language is accessible to all young people, remembering that sometimes we're recruiting people as young as the age of 12. So yeah, there are lots of different ways, and all of that serves to just improve research. So yeah. I think everybody wants to do that.
Yeah, so important to do, but not necessarily easy. And so as we're talking through some of the things that we've done here at Origin in this talk today, we were reflecting on this quote from Marie Brown and Nev Jones that says that what happens, this is talking more broadly about, they use the term service user involvement in research, reflects really what's happened in the peer workforce in mental health. And they say that, you know, we've got forms of participation designed to incrementally improve a specific research project or implementation effort, but rarely are they oriented towards a more fundamental rethinking of what matters and why. And we are certainly not there yet, but this is an issue that all of the people looking at involving or partnering with people with lived experience to do research, I think are facing this challenge of how do we get it to a much more, you know, positive, you know, workable situation. And I will just take the time to say that we are talking from the perspective of an established mental health organisation. So there is fantastic work going on in terms of consumer-led organisations and consumer researchers. We are talking about an existing organisation that has a long history of youth participation, but we're talking about how organisations can try and build their capacity to work together with young people to conduct research. So just acknowledging that that is our lens. We are talking about a range of different ways to involve young people. If we're, you know, we talk about Hart's ladder of participation. Some of you might be familiar with that. There's a kind of an older way of trying to describe different levels of participation that young people might have. In the paper that I'm going to talk about in a minute, we put together a bit of a model, and this has been adapted by the people in the paper below more recently, and I really liked what they did with it. So I'm including this one here to show that we're talking about different levels of involvement. So at the bottom in the orangey red kind of colour there, you might have affirmation where, you know, you might say, hey, I've got this research project, I've already developed it, what do you think, do you like it? And that's, you know, that's fine, but it's a really kind of low level of participation where leading up to the youth-led stuff, you know, at the top of that kind of left-hand column is that more intensive, you know, youth peer researchers undertaking the work, that their ideas that they've come up with and so forth. So, and in between, we've got all different sorts of ways of partnering. And then down the bottom in the green bit, that green arrow should really be kind of all the way through, because I'm trying to describe the research cycle there. And this is just a very simplified view of the research cycle, but we're trying to make the point here that you can have different types of ways of partnering with young people at different stages of the research cycle. And some are easier than others. And there's a range of different methodologies, co-design methodologies, participatory research methodologies that you might use, but it is possible to do these kinds of partnerships at different stages of the research cycle.
Yeah, definitely. And on that note, I would really like to plug the importance of having a range of different opportunities for young people to be participating in different capacities throughout the whole spectrum that is presented on the slide. And the reason why I say that is firstly, because you will harness the power of youth participation to a greater extent, but secondly, some of the systematic issues that might arise when trying out youth participation are perpetuated by the idea that there is a power dynamic between the organisation and the young people. So if you have young people involved at different levels of the professional hierarchy, that's a great way to address systematic issues that might pop up. And just on that note, I would say that it's important to have a culture which supports young people at all levels of the professional hierarchy. So whilst it's all well and good to be like, oh yes, Mel said we should pop in young people on the executive or in their own projects, it's not necessarily going to be a productive or a safe experience if the people who are working haven't got their heads around youth participation and how they want to go about it and how to make it a positive experience for everyone. So it's having everyone involved, but having a culture that supports that.
Yeah. And we will talk about some of the kind of what Mel calls the thornier issues towards the end of the talk. But basically, we're going to describe really a bit of a program of youth participation and engagement that was building on the existing program that we had at Origin, that started to kind of grow around 2015 when we became a national organisation. And we now have kind of global arms of the organisation, so it's continuing to grow. We are a continually evolving organisation, and it's hard to keep up with things, and particularly to make sure that the stuff that we're doing matches the needs of the young people that we're working with. But so we'll talk about the program later on, but just to say that we knew that involving young people in research in a more intensive way was going to be tricky from the start. So what I did when we were first setting this stuff up back in 2015 was to go and interview some of the researchers at the Centre for Youth Mental Health. And so I conducted these interviews with colleagues, 19 colleagues from a range of different academic levels of seniority. And then Sarah Faithful, wonderful master's student who's gone on to work in the UK in youth participation, has analysed these data. So I'll talk a little bit about what were the barriers. Used interview questions based on Susan Mitchell's theoretical framework for behaviour change, and asked researchers about their understandings of youth participation, their desire to undertake this type of research, factors that helped or hindered their ability to engage with young people, and also how well they felt supported by Origin as well. So the barriers list, if you look at the paper, is a little bit longer than the enablers list. We know that this is challenging. And really, when we asked about people what they knew about youth participation when it came to research, the knowledge did differ, and the people in more senior roles had a better understanding of it. But those people that did have a better understanding also knew that this was messy stuff, that it was difficult to do well, and they perceived more challenges, had less confidence, but did want to do it more because they knew that when they did it, it did work really well. There were concerns from researchers about the rigidity of science and anxiety about the loss of control about some really, tightly controlled designs and ways of doing research. They were concerned that some of their colleagues might not feel so positive about involving young people in research. Some of the research assistants said, well, I've got a really set role. There's not so much that I can do. So different people felt like they could have more flexibility in their roles to do this sort of stuff. And researchers at a general, independent researchers were stressed. They felt the time pressure. They needed the right sorts of resources. Not having those resources or that knowledge how to do it were some of the barriers. And you can see a quote there from one of the researchers down the bottom. You know, it is about having the time and the money and the energy in order to support somebody to be involved in research fully. But there were some enablers. So having colleagues or being in a team that really valued youth participation in research was a positive thing for people. Having the right kind of culture to encourage this sort of stuff. Having dedicated staff members and resources. So this is the kind of the structural stuff that organisations can do. Having youth participation and engagement leaders, and also an accessible group of young people. I suppose because of those time pressures and not knowing how to do this, having young people that you can readily engage with and build relationships, I think is really important. Like Mel and I co-wrote a book chapter together, and so I've talked about lots of the things that we're talking about today over time and have built that relationship, and there's a real merit in that as well. Back to the topic, also organisational procedures and processes. So one researcher said, yeah, I'm lucky my team, they're all big believers in youth participation, and it's something that's been embedded in any of the work that they've done. So, so we kind of had that sense of how things were going to go, and now we'll talk about what the kind of the programs were that were set up. And this slide is just to show that the whole strategy is described in this paper, and it wasn't just about research. We were trying to put young people and their families at the forefront of everything that Orygen did, whether it be research, clinical, policy, whatever. But we're going to talk today about the kind of the research focused things. And as I said, it was building on an existing history of youth participation at the organisation. So do you want to talk about what we've done?
Yeah, sure thing. I mean, if I was going to describe the youth participation model as a whole at Orygen, I would talk for much longer than we have time for. So I'll just focus on the national level, where there are two councils. There's the YAC, or Youth Advisory Council, and then there's the YRC, the Youth Research Council, which is the one that I'm on and is most relevant today to today's topic because it is about research. So just describing that in a little bit more detail, the national councils comprise of approximately 9 young Australians aged 16 to 25, and we really value making sure that there's a diverse set of experience and perspectives. So that includes people with varying genders and sexual identities, different cultural backgrounds, lived experiences of mental illness and caregiving. There's people from all over Australia, metropolitan Australia, regional Australia, and also people with different ideas and skill sets. So that's super duper important. I'm really glad that that's the case. There's monthly meetings and we get reimbursed, and there's biannual face-to-face meetings, which we're also supported to do, which is great, again, because we want to make sure that financial barriers don't stop young people from getting involved in this program, because that would obviously then decrease the quality of perspectives. We want to make sure that there's a range of them. When it comes to the actual work that we do, often a researcher will come to our meetings and they'll have questions about their project that they'd like to ask us, and that really varies depending on the person that we're speaking to, but it could be as broad as research questions. For example, there was a project that said, can you guys tell us a little bit more about how COVID is impacting young Australians right now, and we'll design our research around what you think is most important. So it can be as broad as that, or it could be, have a look at our risk management strategy. Do you think this is overly patronizing, or would you include more? So there's lots of different types of questions ranging from research design, methodology, data analysis, risk management, recruitment, translation and dissemination of findings. So yeah, we really do enjoy providing our thoughts on all of that. And then just to speak to providing feedback at every step of the research cycle, as we've discussed a little bit already, I'm also representative of the Youth Research Council on Orygen's Ethics Committee. And at that stage, I'm looking at participant information and consent forms, checking that the language is clear and accessible for people who will be potentially involved in the research project. So yeah,
so definitely what we've tried to do is to try and build in some structural kind of, I suppose, supports and ways in which researchers can be reminded gently to engage young people in all of the research that we do, but also that young people have a seat at the table. And in this case, it's an ethics committee. That was never part of the plan. But when we had our first Youth Research Council, we really realised that we needed to do something that kind of embedded this structurally in the organisation. So 2 Youth Research Council members are on the Research Review Committee or the Human Ethics Advisory Group. And so you can see there's kind of a few things that we've done to try and really embed it in all of the research, but then also with specific projects. So I think one of the challenges in partnering with young people is not doing it early enough. So researchers often wait until they've developed their project and then will take an intervention or take a, risk management form for kind of comment or for involvement. And so we've tried to do things like pitch sessions where researchers come and present to the Youth Research Council and or Youth Advisory Council to say, well, this is the idea that I'm going to put in for grant funding next year, and get that input at the early stage. We've also had a lot of advisory roles, and some of the research that's done at Origin obviously lends itself so well to youth participation, and increasingly we're seeing peer researchers be part of teams, which is fantastic. So working towards different levels of involvement, but also reflecting that, not all young people want to sit on a national council, not all young people want to do, ethics committee stuff, but also I would say don't underestimate the degree to which, I think there's a lot of assumptions that young people don't want to read through applications or don't want to look at stuff that might be considered boring, but actually young people are super keen to do that. So it's really good to have the expertise there.
Yes, we are.
Yeah. And so we do have some resources on the Origin website, and really another thing that wasn't anticipated but that we set up with the first Youth Research Council was a bit of a kind of a very brief toolkit that could be a conversation starter. So to try and set up youth partnerships in a positive way from the outset. So this is just one page of the toolkit, but it has some principles about good youth partnerships, having clear expectations, being flexible, making sure there's mutual benefit, all of these sorts of things. But interestingly, these kinds of things can also be used as a bit of a check measure, when you I've taken it back to previous councils, the one before yours, Mel, and said, well, how much of this stuff is getting done, and the answer is about half of it, in reality. So researchers aren't always great about providing feedback, for example, about what change has happened as a result of young people's involvement. So really looking at ways in which we can improve the quality of those relationships, because you want those partnerships to be positive, because you want young people to kind of want to do it again if they are going to head into a career in research themselves, then you want them to be, wanting to do it with young people as well. So all of these sorts of things, there's risks in doing it poorly. Young people might not want to do it again, but it can also be re-traumatizing if you have a negative experience when there is that kind of power dynamic involved. So did you want to talk about experiences or move on?
For sure. I can speak to the guidelines that are on the slide at the moment, with both a positive experience that I've had and a negative experience. So to start off with the negative one, I was a lived experience advisor on a research project, and it was amazing because they were obviously super keen to get me involved, but I was left feeling that perhaps they hadn't planned how they were going to engage with youth in a best practice kind of way. So firstly, I wasn't reimbursed, but I was aware that all other members on meetings were, which obviously felt a little bit strange. On the first meeting, I was asked to share my lived experience straight off the bat before having introduced myself in general or anyone else on the meeting. And of course, I'm happy to share my lived experience, but usually prefer to feel autonomous in the process of doing that, and also with the understanding of why it's important at any given time. There is also little structure to meetings for where I would share my ideas, which meant that the power dynamic was a little bit amplified and I really had to push in. Sometimes when I did have ideas, things were already finalized, but unfortunately what happened is that a participant raised the exact issue that I had forewarned the research team about, and then they went to me asking, oh, what should we do now? Which left me feeling pretty disillusioned, because of course I'd already mentioned that I thought this might be a problem. So that obviously wasn't the best time, but thankfully I have had positive experiences as well. For example, recently on the ethics committee, which we were just talking about, I raised a point that I was providing quite repetitive feedback to researchers, and then the committee enabled me to lead a project about providing best practice guidelines and principles for researchers who were writing participant information consent forms. I was supported to write the first draft. I was supported to do consultation myself, but at every step of the way, there was the option for other staff members to do that alongside. So there was that flexibility, that autonomy, and of course, closing the loop, making sure that we went back to all the young people that we consulted with and said, hey, here's what we did, here's what we didn't, and why. And if you would like to have any further discussion about that, then we're totally open. So that was a really good experience.
Yeah, which is awesome. And not that we can't talk about bad things that happen at Origin, but that negative experience, as I understand it, wasn't at Origin. No. And that is, I suppose, why we have these principles involved, because we will absolutely always reimburse young people so that involvement isn't a financial barrier. And we certainly don't do things perfectly, but I think as an organisation and other organisations watching this might be interested to having these kind of principles and procedures embedded in the organisation so that things can still go wrong, everything can go wrong, but you can try and minimise the degree to which things don't go well for young people that you're involving. So having some sort of principles that you work to is really important, I think. And we will try and briefly talk about, we're trying not to go over time today, but we will try and briefly talk about some ongoing challenges. When we're talking about this, we're talking about ongoing challenges that Origin has, but also internationally in the organisations that I speak to around the world that are trying to do this sort of stuff. The challenges are pretty similar, actually, and that in the youth mental health space, it's adequate training and resources that kind of meet the unique needs of different types of young people. Trying to have diverse representation, so across the age range, 12 to 25 is a really large age range, and making sure that opportunities represent things that different young people will want to engage in. Also, aging out's a bit of an issue as well, because we all get older, and making sure that we have the youth perspective means that at some point people who have amazing knowledge and amazing skills, that through all these sort of partnerships will then need to graduate into alumni roles or into sort of a different area kind of roles, and so making sure that that's sort of thought about from the outset, and that there is some sort of pathway for young people to move into different types of lived experience. I'm borrowing Louise Burns' Consumer Academics term about psychiatric disability, making sure that we're involving people with lived experience, not just as one group, but acknowledging the nuances in that. And Indigo Daya talked about that beautifully in the last talk in this series, that we need to acknowledge our lens and make sure that we're including a diverse range of voices, including those that are not going to say, oh, yeah, that's great, not that affirmation sort of stuff. Different cultural backgrounds. Something that we need is better role definition across the sector. So what is a reimbursed volunteer opportunity? What is a paid employee opportunity? Working with ethics committees to say that this person is a partner, not a participant, really trying to get that structural kind of support for doing youth partnerships. And also having some, like Mel said, things can go wrong. And so what happens then? Making sure that we have some ways. Is there anything that you wanted to talk about, or should we?
Just very briefly, I'd say that when things go wrong, the most important thing is to speak to the young person involved, listen to them, because they will likely have their own ideas and perspectives about the ways that they want to be heard or where to from here. But if anyone has any questions about more detail, then I'm happy to answer them, but time is running out.
Yeah, okay. So we'll just talk about the take-home messages. If you want to do this, but you're not doing this, if you're a researcher or an organisation, there's no perfect time, so jump in, but you've got to be prepared. So get the skills, get the resources, training, the right mindset's really important, understanding that there'll need to be cultural change and contingencies for when things go wrong. It's increasingly required in stuff, so it means that traditionally researchers who are really into this kind of way of working might have been engaging young people, and increasingly different types of researchers are being required to partner with young people. So don't jump in unprepared, I suppose, is the point. Reach out if you need help. Being flexible is no excuse for being underprepared. You need the structural supports. And we also need these from our national funders, the people that are providing the funding for research need to really allow mechanisms for how young people can be involved to improve it. And of course, youth participation leaders and teams play a role in that. And for the field in general, we need better evaluation and research of programs, how they work well, and some good quality indicators so that we can kind of move the field forward. And that way we'll maximise the opportunity that youth involvement presents, like it's a real opportunity to improve things, and then we can improve the value and the impact of research.
Totally.
Yeah, and that's it from us for now. Oh, there is some acknowledgement, sorry. So we don't think about this in a vacuum. This is not representative of all the people working in the space at Origin, but it's people that I've personally had discussions with and you've had discussions with that have really helped our thinking along. So I'd like to acknowledge them, particularly Jackie Falashevsky. And then also heaps of papers out there. We put a small number of them here just because often students are interested in this topic and this area, and you know, there's some suggested reading. And also, if you don't have library access, if you're joining us not in an academic position, then please reach out. We're happy to help you out there. And we will have a book chapter coming out in a book, so follow us on Twitter and you might hear about that too. Thanks so much.
Thank you, Magenta and Melissa. That's very interesting material, and having been a youth researcher for many years, it's wonderful to hear the work continuing forward and getting the voice of young people in the research that you do. It's so important. So now I'd like to ask for questions. We have one there and I'm going to read that one out to you both. I messed up the questions before, but I'll try and fix it up now. Okay, so it's from Karina. I'm wondering about the potential behind partnering with the student union or any clubs, associations to increase engagement, and also if perhaps the steering committee in the foundational strategic planning stages was something explored or considered, and she wanted to thank you so much.
Excellent. Thank you. Did you want to talk to that or do you want me to? I'll just pop the question up so we can read.
Yeah.
So yeah, definitely, I think partnering. So, I mean, really what we're talking about is part of, you know, what is sometimes called patient and public participation or public and patient participation. I know the term patient is contentious in the mental health area, but that's kind of really about involving the public in improving research, because that's really important to do. So when it comes to young people, not everybody will, who presents at a mental health service will want to engage through that way as well. So working with, you know, student unions or, you know, community clubs as well to really try and make sure that all of the stuff that we're doing, because not all of our research is intervention research for, you know, specialist services. For example, you know, some of it might be about prevention research out in schools and things like that. So I think it really speaks to the point of making sure that the young people that you're partnering with are similar to that the research is about. And so I think there's a real risk in, you know, in that qualitative study that I spoke about was young people, researchers wanted a group of young people that they could go to, but we would invite researchers to consider whether that group of young people is really the right group of young people, and to develop relationships, because you need to do that over time. That's really important, with the types of young people that can meaningfully contribute with the right lens to the sort of research that you're doing. I think that's really important. Yeah.
I would just quickly add that I 100% agree with the person who wrote the question. I think there's a lot of potential and a little bit of a gap of engaging in these sorts of processes, particularly in university settings. I say that as a university student. I'm studying psychology, and I don't know if I've heard anything about this going on. So if there's anyone who has any capacity to get that going on in a university context, I think that would be wonderful. I don't know if there's funding issues, but in my mind, I don't see why not. So
yeah, I mean, one of the things you find when you do a lot of research is that funders are not overly aware of the amount of time it takes to actually build those relationships, and then how you build that into an actual research project. And so what you're talking about is really good, because it is something that can be presented to funders to help them understand the value of the work, but also the amount of time that it does take, and how it's not something that can be just rushed through. as a sort of a token thing.
Yeah, absolutely. And something that I didn't speak about, but that we did do, was we allocated a sort of a small pot of money to researchers, because what will happen is we're saying, hey, can you involve young people before you apply for a grant? Because we need that. We don't want tokenistic kind of involvement where it's already decided, but we want young people to be involved from the outset. But they would say, well, we don't have funding to do that. So what the organisation did was set aside a small pot of money that researchers could apply for, to partner with young people to develop that idea, so that they could then apply for money with a plan that was informed by young people. So
which
social support as well.
Yeah. I've got one more question here from Alicia. I really like the idea of the relationship is important within research. What tips do you have for building these relationships with young people from your target group?
I can answer that one. I feel like there are a number of different relationships that are important. Of course, there's the relationship that the researcher has with the target group, and then there are other relationships which support that to happen in a positive way. So firstly, to answer between the researcher and the young person, I think there are a few ones that are easy to forget, but really important. So using lay language is absolutely essential. Otherwise, people can feel a little bit of a do I really belong here? How can I contribute? So it's important not to feed into that kind of idea. Providing information about the study or whatever it is that you wanted to speak to young people about prior to the consultation can also be a really good way to make them feel really comfortable, having already reflected about things and confident to share their ideas. And then, of course, there's basic people skills, communication skills and respect, which I'm sure everyone has, but just remembering that this comes from a place of lived experience, and it's a good idea to talk in that kind of context rather than strictly, researchy, and it's just a different tone. And then a bunch of different activities, say when you're introducing yourself, you'd be like, also a skill that I wish I learned in my sleep and woke up with, and everyone around the Zoom room can share their response to that question. That can really just nice welcoming vibe. Yeah,
I think humanizing researchers is really important, because I think that often young people might in that power dynamic sort of hold researchers up as these smart and clever people, and the reality is that not always the case. And so really I think another thing that we wanted to stress in this talk that we didn't do unfortunately, but I'll add in now, is that training, I'm not talking about just training young people in how to learn about research and how to be involved in research. I'm talking about training for researchers in those engagement skills, and some of that relationship building that you're talking about there is super important, because you do need skills in how to really change your mindset and go, okay, I don't have all the answers, and actually there is real value in contributions from young people, and my research shouldn't just be my research, it should be our research, and it will be better if we have that contribution. But there are skills that you need to learn in order to do that, and some of it you just have to kind of dive in and do, but others you can be prepared for as well, particularly speaking to people who have done it before.
Okay, so we've got another question that's possibly a little bit similar. How do researchers find suitable young people with lived experience to partner with?
Yeah, so I think you do need accessible groups of young people. So they're for example, the Centre for Multicultural Youth have a program called Explore, where they have a pathway where researchers can contact young people who have been trained and to partner with them. So they're kind of providing that service really in a way, which is great. Researchers though really need to kind of think about who they're researching, who their research concerns, and build relationships with perhaps organisations that already partner with young people and have access to those sorts of young people, whether it be different types of backgrounds or different types of mental health challenges, really forming those connections. And that's the sort of stuff that we don't traditionally see as part of our job, but I think is really important. Young people are not going to turn up on your doorstep in order to form these partnerships, and finding them can be really hard. But reaching out to your collaborators who do this sort of work you know, speaking to organisations that have, you know, access and can provide advice on how to, you know, partner in a sensitive way or in a kind of appropriate way is really important. So it depends on what research topics you're thinking about and who the right young people are, and then figuring out what the right pathway is. So there's not really one answer, but the organisation that you work for as a researcher should be thinking about that and thinking about the relationships that they have, and how that kind of facilitates this. You can't just do it as a lone researcher by yourself.
No. We just got a question here from Piers. Do you use different levels of remuneration for different lived experience contributors? How do you adequately remunerate those with more experience compared to others?
So we don't, we use a flat rate, and there's been much discussion around this. At times we've had proposals of varying the rate depending on the kind of the type of contribution, you know, and the type of involvement that's required. And we've never settled on something, I think, that really that kind of works. We want to make it an equitable system. We are talking about, though, the focus of this is really reimbursed volunteer roles. So it is a volunteer role. It's not something that would be otherwise a paid role. And so the reimbursement is there to try and minimise any financial barriers to being a volunteer. But if you've got certain expertise and you've developed that expertise and you're doing something perhaps more involved, I would say that that should move into a paid role, and that would be an employee role. And then it would be commensurate with what that role would offer in terms of a financial salary otherwise. So whether it be a casual RA role or something like that, peer researchers type role, I think it needs to be commensurate with what otherwise would be paid. And that's tricky because, you know, for example, if you want to employ a research assistant, then often the criteria for key selection criteria is having, you know, like an honours level qualification, and that's not necessarily something that people will have, obviously, you know. So that's really kind of tricky in order to work with HR systems, and that's what I was talking about with funders before. It's not just funders, it's HR organisations and stuff to recognise the difference between learned experience, like qualification-based experience, and lived experience, but also those skills that you've developed once you kind of do a bit of this and you do develop that kind of expertise, that should be something that is remunerated appropriately. And it's really about determining whether, at what point does this be, is this a truly a volunteer role, a reimbursed volunteer role, or is this a paid role? And that's one of the kind of the challenges that I spoke about, glossed over a little bit, but that kind of that role definition on that slide about where the line is, I think is really tricky in research. And we need to have more guidance on that, I think. Yeah.
And it would very much depend on what you were doing and how you'd set your research project up as well. Yeah.
Absolutely.
Yeah. Okay. That's the end of the questions. So I'd like to thank both of you very much for presenting, and to the audience, thank you for coming along to listen to us today and give us some questions. The next event in the series is on the Thursday, June the 3rd at 1 p.m. And the speaker will be Professor Helen Cahill, who will discuss social and emotional wellbeing programs in schools. And Claire will post a booking link for this in the chat so that you can book in right now if you would like to. It's all there. So thanks very much, both of you. It's, I think, been a great contribution to our series, which is new this year, and we're very excited about having these once a month seminars. So thank you very much, both, for coming.
Thanks so much, Helen, and thanks to everyone who came and listened, and yeah, to the MSEI for inviting us. Thank you.